Robert Liston was a Scottish surgeon known for the incredible speed with which he would attempt surgery. This wasn't just a coincidence of his skill. Liston intentionally tried to complete surgeries, including amputations, as fast as possible, even asking his students to time him before he began. The speed at which he went about hacking up his victims, patients, led to some mishaps, including his credit as performing the only surgery in history to have a 300% mortality rate. Born in Scotland in 1794, Robert Liston was an intimidating man standing at 6'2". He was also regarded as domineering and argumentative, and he fell out with his tutor, the famed anatomist Dr. John Barclay, while studying in Edinburgh Medical School in 1816. This led to Liston opening up his own anatomy class and marked the start of a long career as a medical practitioner who just kinda did his own thing, in spite of the prevailing practices of the time, and one who was often at odds with his peers, frequently expressing his disapproval of surgeons he did not respect and thought to be inferior. Liston moved around from position to position for a while, sometimes spurred by disagreements with more senior surgeons, until he accepted an appointment as Professor of Surgery at the newly opened University College Hospital in London. He was only 34 at the time and would remain there for the rest of his life. His standoffish personality made Robert Liston widely unpopular among his co-workers, although none could deny his skill in surgery. He would make a point of performing rapid surgery to galleries of onlookers, proclaiming, "Time me, gentlemen, time me," before operations. He would go about amputation so quickly that the flash of his knife could be missed by onlookers entirely, before he had already moved on to the bone saw, clutching the bloodied knife between his teeth to save time. Now, I'm no doctor, but I don't think a surgeon should really be putting any of their instruments in their mouth during an operation, or in any other cavity for that matter. But this was a different time, and Robert Liston actually had more consideration for hygiene than most surgeons, being one of the few to wash his hands before operating. He would also wear a fresh apron for every operation, at a time when a surgeon's bloodied apron was a sign of experience. The stiffer the apron, the prouder the surgeon. A good surgeon wouldn't need to hang up his apron because it could stand up by itself, and a true veteran would walk to work side by side with his apron. It was recorded that Robert Liston could amputate a whole leg in 2.5 minutes, and he could amputate the leg below the knee in just 30 seconds. This amazed his onlookers and earned him the nickname the fastest knife in the West End. This didn't do much to ingratiate him to his detractors though, who saw this only as a sign of his arrogance. But showmanship aside, Liston did actually have good reason to do this. In an era prior to anaesthetics, speed made a huge difference both in terms of how much pain the patient would be subjected to and their chances of survival. Imagine you had to get your leg amputated without anaesthetic, and some big Scottish fella says he can do it in 2.5 minutes. Well, first you should probably make sure he is indeed a doctor and not just your average Glasgow heart merchant, but if he has a medical licence and it's got to be done, then let it be done quickly, right? Now, sometimes Robert Liston was a little overzealous in his speed. He once took off a patient's testicles along with their leg. If you're going to make a mistake like that, I'd rather you accidentally cut off my head, to be honest. Another story says, in a flurry of knife cuts, he lopped off an assistant's fingers as they were holding down a limb. Then, in his rush to switch instruments, he slashed a spectator's coat. The spectator was so shocked and afraid that he'd been stabbed that they dropped dead of shock, and the patient and assistant both died of gangrene afterwards, making it the only operation to have a 300% mortality rate. This is a very popular story, and you may have even heard it before, but it may not be true, as no primary sources confirm this surgery ever took place. The story may just be legend or rumour stemming from Liston's speed and the fact he wasn't very well liked. Even his own students feared him, as he would harshly berate any mistake or failure to meet his standards in front of crowded galleries. If you've ever had a boss chew you out in front of your co-workers, you know it's not the greatest feeling in the world, and by now you're probably thinking, this guy sounds like a real arsehole. Perhaps he was, but he was also a very principled man. The same students who had felt his wrath were often invited to his home for a plentiful dinner. He took pride in operating on patients that other infirmaries had deemed untreatable. This once again was seen as a sign of his arrogance, but Liston tried to help every patient, no matter their condition, and his skill meant his surgeries had a mortality rate of 1 in 10. For comparison, surgeons at nearby St. Bartholomew's lost about 1 in every 4. Another example of his ethical nature is a confrontation he had with his colleague Dr. Robert Knox. Knox was a central figure in the famous story of Burke and Hare. The two were a pair of murderers who sold corpses of their victims to Dr. Knox for dissection. Mary Patterson was a woman who had been murdered by the two, and Knox had kept her in whiskey for months before her dissection. Liston was suspicious of foul play, and upon seeing Patterson's body on voyeuristic display, became enraged and physically confronted Knox, knocking him to the ground and retrieving the body for burial. So it seems Robert Liston's reputation for being abrasive and argumentative perhaps stems from his confrontational style when his principals were offended. Maybe he wasn't liked because he was one of the few sane people in a world full of dolts. As mentioned, he often did things that were seen as silly at the time but were actually very forward-thinking, like promoting cleanliness. His operating style makes him sound like a bit of a butcher, but he actually considered the patient's emotional state to be of crucial importance. Understanding the agony and distress that surgery caused, he would try his best to put a patient's mind at ease and would cancel or postpone operations when a patient was overcome with fear. He also believed that a successful surgery was just the first step to recovery, saying he must consider his labour only begun when the operation is finished. The patient is yet to be conducted by kindness and judgment through the process of cure. As skilled a surgeon as he was, he thought it was equally, if not more important, to know when not to operate, saying, "Who will question that there is more merit in saving one limb by superior skill than lopping off 1,000 with the utmost dexterity?" But he wasn't just ahead of his time in his thinking, he was a true visionary, inventing numerous medical implements like the bulldog forceps that held arteries together to control bleeding, and a leg splint used to stabilize dislocations and fractures of the femur. These are still used to this day. He also performed the first operation to use modern anesthesia in Europe in 1846. From a bottle of ether, Liston placed a tube that led to his patient's mouth, knocking him out shortly after. An assistant held a handkerchief doused in ether to the patient's mouth while Liston amputated his leg. The patient woke up after the leg had been removed and asked, "When are you going to begin?" The gallery erupted in laughter, which confused and distressed the patient, who shouted, "Take me back, I can't have it done." Assumedly, they said okay and let him walk off. Two of Liston's students present at this operation were greatly impacted by the display. James Simpson, who was only 16 at the time, went on to pioneer chloroform's use as an anaesthetic, and Joseph Lister developed aseptic technique and antisepsis, combating infection that was poorly understood at the time and frequently resulted in patients' deaths. A year after this surgery, Robert Liston died of an aneurysm. He was 53 years old. With his contributions to modern medicine, it's really a shame he's known to the public mostly by a story that paints him as a butcher, and probably isn't even true. His reputation is somewhat tarnished by the fact he was disliked by many of his peers, and it's hard to say if that's because he really was hard to get along with, or because he was so unflinching in his commitment to go against everyone else's thinking with ideas that weren't popular at the time, but would ultimately prove to be the best way forward. As is usually the case, it was perhaps a combination of the two. Well, if you liked this video, I have plenty more in a similar style, and plenty more in dissimilar styles, so I have something for everyone, unless you just don't like me. If that's the case, remember, lots of people didn't like Robert Liston either, but look at him now, dead. God, I wish that were me. If you'd like to follow my videos while I'm still kicking around this mortal coil, then subscribe and you'll see a new one every week. You can buy a channel membership if you'd like to monetarily support the channel, and follow me on Twitter if you'd like to be annoyed by my opinions. Till next time, stay safe.